dawn in the foothills of the Cascade Mountains in the most remote reaches of East Lynn County. Sunset on a breathtaking Pacific beach in Lincoln County. And in between, the mid-Willamette Valley, home of agribusiness, metal and wood product industries, and significant educational resources. The valley features lively medium-sized cities nestled among postcard-perfect covered bridges and small towns with close-knit communities. This is Samaritan Country. Samaritan Health Services focuses on improving the health of more than 250,000 people living in Oregon's mid-Willamette Valley and Central Oregon coast. Earlier in this century, community leaders in Benton, Lincoln, and Lynn counties came together to establish a unified regional healthcare system. They understood that a shared mission and a commitment to cooperation, rather than competition, would strengthen and expand local healthcare options for their own families and their neighbors. Pioneer physicians, fresh off the Oregon Trail, were among the earliest settlers. These mavericks were ready and willing to pursue their calling despite the hardships. In every corner of the 3 counties lived horse and buggy doctors who visited isolated farms or boarded boats to help remote coastal patients in need, often performing surgeries on dining room tables or in hotel rooms. Some even opened up their own homes to pregnant women or patients in dire straits, because there were simply no other alternatives. By the early 1900s, small hospitals had sprung up in Sweet Home and Lebanon, and the St. Mary's Rectory in Albany was repurposed for the same need. In Corvallis, a hospital was the initiative of 125 doctors and a handful of investors pooling their resources. Lincoln County doctors made good use of hot sea baths or former hotels to create sanatoriums and provide inpatient care. The doctors who controlled the small hospitals incorporated nurses and support personnel to make their endeavors viable. The idea of a healthcare team was born out of necessity, but the contributions of support personnel became unmistakable in these earliest of inpatient experiences. By the mid-20th century, a generous public impacted by the committed healthcare providers added funding and friendship to improve or rebuild medical facilities. Local champions stepped up as active hospital volunteers or investors and formed community advisory boards. Adding to this local momentum were federal matching funds released after World War II to improve or create new hospitals. A frenzy of construction across the state also included local facilities in the 3 counties. In Lebanon, the Mennonite Church helped to finance, build, and manage a new hospital. In Corvallis, bonds plus assistance from the Episcopal Church established the Good Samaritan Hospital. Albany added a wing to its 1920s building, but later determined an entirely new building was needed. And all was accomplished within the span of 15 years. In Lincoln County, health districts were established utilizing property taxes as a funding stream to ensure that contemporary facilities would remain viable. New funding was followed by the advancement of healthcare administration theories and practice, and the region attracted new leaders who envisioned services and technology to take hospitals beyond general inpatient services. As the 20th century came to a close, the following patient-focused programs were commonplace: 24-hour emergency services with specially trained emergency room staff. Advances in anesthesia plus new surgical techniques created the opportunity to develop outpatient or short-stay surgery centers. Home health for recuperative care. Hospice for end-of-life care. Birthing centers opened in support of shorter inpatient stays. An explosion in community health education offerings and support groups took healthcare and wellness beyond a doctor's appointment. Excellent ancillary services, specifically clinical laboratories and imaging services, became vital tools for physicians in their diagnosis and treatment responsibilities. Psychological and social outreach, both for patients and families, was coordinated with the most common pastoral care options. Interdisciplinary cancer services were introduced. Outpatient physical rehabilitation and sports medicine programs targeted specific patient groups, as did outpatient cardiopulmonary rehabilitation centers. Mammography services and breast cancer outreach activities. community advocates in Benton, Lincoln, and Lynn counties establish stronger links with local hospitals and physicians to offer low-cost or free clinical services to financially needy populations. Each of Samaritan's 5 hospitals can chronicle its caring service to the community. But the history of the not-for-profit regional network, that is today called Samaritan Health Services, is now nearly 2 decades old. Born of a common mission to provide exemplary health care and keep decision-making local, Lebanon's Mid-Valley Healthcare and Corvallis's Samaritan Inc. were the first to merge in 1997 to form the not-for-profit Samaritan Health Services. The merger reflected the belief that an integrated organization would serve their communities more effectively and efficiently. 2 years later, they were joined by Albany's First Care Health, which included a hospital, physicians group, and storefront outpatient services. By 2002, Samaritan expanded to include the Central Oregon coast. Samaritan now operates hospitals in Lincoln City and Newport, the latter of which is part of a long-term management contract with the Pacific Communities Health District in Newport. Both communities are actively working on construction plans for new hospitals with expected completion to be in 2018. Today, the 5 Samaritan-affiliated hospitals, together with associated physician clinics and several health plans, continue to serve their local communities while working to build healthier communities together. Building healthier communities together has become the work plan for our new century. These specific services demonstrate what can be accomplished when communities across the region work together. Originally initiated in the 1990s by Good Samaritan Regional Medical Center, Samaritan now offers a comprehensive multi-community mental health program that includes a 24-bed adult inpatient unit and a range of outpatient treatment options. The Ralph Hall Regional Heart Center opened in 2002 in coordination with all communities to provide comprehensive heart and vascular services to the region. Samaritan Heart and Vascular Institute provides advanced cardiology, cardiovascular surgery, cardiothoracic surgery, and electrophysiology services with clinics in Albany, Corvallis, Lebanon, Lincoln City, and Newport. An affiliation with Stanford Medical Center also offers additional consultative services and access to professional educational resources and research. Samaritan Heart Spring Wellness Centers in Albany and Corvallis provide integrative primary care, osteopathic manipulative treatments, naturopathic medicine, acupuncture, nutrition counseling, chronic disease management, mind-body counseling, massage therapy, movement therapy, and classes for the mind and body. Recognizing that a holistic approach has many benefits to healing, Samaritan has taken a proactive approach in integrating arts into healthcare, with local artists at the bedside, musicians in common areas, commissioned artwork, and healing gardens. In the spirit of extending the integrated care philosophy, the state-of-the-art Samaritan Athletic Medicine Center, located on the campus of Oregon State University, opened in 2014. The center serves the general public and Oregon State athletics and serves as a site for student internships, training, and research. Through regional fundraising efforts and the determination of one Corvallis leader, the Mario Pastega Guest House in Corvallis opens its doors as a home away from home for out-of-area patients and families traveling to Corvallis for specialty medical care. An equally impressive multi-community funding effort resulted in the Samaritan Evergreen Hospice House. Only the 3rd such facility in Oregon, the 12-bed inpatient Albany facility attends to the needs of dying patients and their families. The growth of hospice within the region has also grown as Samaritan communicates a new understanding of end-of-life and palliative care options. The Samaritan Early Learning Center features hands-on learning experiences for children appropriate to their age development stage. Families in the Lincoln City area enjoy access to high-quality childcare in an environment ideally suited for early childhood education and development. Sam Fit is a comprehensive health and fitness center promoting all aspects of wellness such as nutrition, exercise, mental health, and more, helping individuals tailor a plan to reach their personal health goals. SamFit professionals also work with groups or businesses to improve the health status of their members or employees. With locations in Albany, Corvallis, and Lebanon, there are plans for additional locations throughout the Samaritan region. The Samaritan Cancer Program provides comprehensive cancer care throughout the region, including radiation therapy, medical oncology, chemotherapy, surgical capabilities, access to clinical trial, and more. The Samaritan Pastega Regional Cancer Center in Corvallis acts as the hub, with local cancer care offered in Albany, Lebanon, Lincoln City, and Newport. Numerous support services, many of them offered free of charge, are provided for patients and families such as support groups, fitness club membership, and nutrition guidance. Mid-Valley Communities had some experience working together as they developed an insurance product for Oregon Health Plan members. After formal affiliation, Samaritan created a self-funded insurance plan for its employees and ventured into Medicare insurance with multiple plans for Medicare-eligible residents in Benton, Lincoln, and Linn counties. Education and lifelong learning are integral to the Samaritan mission. It has been estimated that nearly 1,000 students interact with Samaritan on an annual basis. For years, experienced and thoughtful physicians and other health professionals have taught medical, nursing, nurse assistant, pharmacy, as well as clinical pastoral education students from educational institutions such as Linn-Benton Community College, Oregon State University, and Oregon Health and Science University. Through an association with Western University of Health Sciences College of Osteopathic Medicine of the Pacific, located in Pomona, California, the first osteopathic residency programs opened in 2009. Residents come from diverse institutions and have a variety of long-term goals, but share a commitment to remain in the Pacific Northwest. The residency programs include family practice, internal medicine, psychiatry, orthopedic surgery, general surgery, and a traditional rotating internship, as well as a cardiology fellowship. The new Center for Health Education in Newport demonstrates Samaritan support for lifelong learning and community education. In a truly unique partnership between Samaritan and Western University of Health Sciences, the first class of 100 osteopathic medical students began studies in 2011 on a 54-acre health sciences campus in Lebanon. The College of Osteopathic Medicine of the Pacific Northwest was the first new medical school in Oregon in more than 100 years. The campus continues to grow, attracting a Best Western Premier hotel and conference center, restaurant, a residential facility for veterans, a crisis management training center, apartments and various medical offices, including dialysis, pharmacy, and medical supplies. Linn-Benton Community College is also locating its Health Occupations building on the campus. Samaritan continues to be actively involved with the communities to plan the future of healthcare. Oregon's 2011 Health Transformation Bill created opportunities to integrate care for Oregon Health Plan members under one organization. For Samaritan's service area, that organization is the Intercommunity Health Network Coordinated Care Organization, IHN-CCO. The IHN-CCO comprises local public, private, and nonprofit partners who are working to literally redesign how healthcare is delivered and to unify health services and systems for Oregon Health Plan members in Benton, Lincoln, and Linn counties. The livability of our part of Oregon attracts outstanding healthcare professionals. They are proud to provide their families and neighbors with compassionate world-class healthcare. Together in our dynamic environment, you will help ensure access to a range of exceptional medical services. You can make a difference for your own family and neighbors through Samaritan Health Services. This is a great place to live and work, and a great place to add your special touch to a tradition of caring that will enhance the health of the region we call home.